Occupational English test. Listening test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now, look at the notes for extract 1.
Extract 1. Questions 1 to 12.
You hear a physician talking to a patient called Mr. James Williams. For questions 1 to 12, complete the following notes with a word or short phrase. You now have 30 seconds to look at the notes.
Hello, doctor. Good morning.
Good morning. What's your problem?
Well, he's my father, and he had a septic shock. And when we consulted locally, the diagnosis revealed elevated cardiac enzyme profile. He had some workup done from cardiac standpoint, which has been negative so far.
Okay. Does he have any previous history of chest pain or shortness of breath?
No, doctor.
What is age?
58 years old, doctor.
Does he have any history of hypertension or diabetes mellitus?
No, doctor.
Does he smoke or drink?
No, doctor.
May I know his past medical history?
Well, he had pulmonary fibrosis, and he is on prednisone, oxygen-dependent cellulitis, status post-foot surgery with infection, recuperating from the same, respiratory acidosis, septicemia, and septic shock, presently on mechanical ventilation. No prior cardiac history. Elevated cardiac enzyme profile.
He had any surgery earlier?
Yes, he had foot surgery.
Okay. What medicines he is taking now?
Vitamin supplementation, prednisone, cyclobenzaprine, losartan 50 mg daily, nifedipine 90 mg daily, Lasix, potassium supplementation.
Is he allergic to any medicine?
Yes, he's allergic to sulfa.
Well, his physical examination reports show pulse rate of 94, blood pressure of 98/57, respiratory rate as normal, air entry bilaterally clear, rails are scattered, point of maximal impulse displaced, S1, S2 regular, systolic murmur grade 2 of 6. There are chronic skin changes, markings in the lower extremities, pulses found palpable. His laboratory reports show echocardiogram is normal, sinus rhythm with wide complex, white blood count of 20,000, hemoglobin 10, and hematocrit 33, platelets of 163, international normalized ratio 1.36, BUN of 158, creatinine 8.7, potassium 7.3 of bicarbonate is 11, cardiac enzyme profile, troponin, 0.05, total creatine kinase, 312, myoglobin, 1423. Chest x-ray, no acute changes. He has pulmonary fibrosis and is on prednisone, oxygen-dependent with respiratory acidosis, septicemia, septic shock secondary to cellulitis of the leg, acute renal shutdown, elevated cardiac enzyme profile without prior cardiac history, possibly due to sepsis and also acute renal failure. I am ordering an echocardiogram to assess left ventricle function to rule out any cardiac valvular involvement. He needs aggressive medical management, including dialysis. From a cardiac standpoint, conservative treatment at this juncture. His cardiac enzyme profile could be elevated secondary to sepsis and also underlying renal failure. Extract 2, questions 13 to 24. You hear a doctor talking to a patient called Mr. Greg Matthews. For questions 13 to 24, complete the following notes with a word or short phrase. You now have 30 seconds to look at the notes. Hello, doctor. Good morning.
Good morning. May I know your problem?
Well, doctor, my husband. Actually, he fell down yesterday morning when he was trying to put his boots on top of the staircase. He fell down 20 steps and he has lost his consciousness. He was evaluated by a local clinic and was amnestic at the time of examination. A HCT scan was taken and thereafter they referred to your hospital.
Well, what's his age?
72, doctor.
Does he drink or smoke?
No, doctor.
May I know his past medical history?
Well, he had atrial fibrillation, right hemisphere stroke last year with associated left hemiparesis and amaurosis fugax. This was followed by a right coronary artery for 98% stenosis. However, the stroke symptoms and signs were resolved. Degenerative joint disease, total replacement of right knee 2 years ago, venous stasis with no history of deep vein thrombosis.
What medications is he taking?
Lasix 40 milligrams once in a day, Zantac 150 milligrams once in a day, Lanoxin 0.125 milligrams once daily, Capoten 2.5 milligrams twice a day, Salsalate 750 milligrams thrice a day, ASA 325 milligrams once in a day, Ginseng 100 milligrams twice a day.
Is he allergic to any medicine?
No, doctor.
May I know his family history of illness?
Well, his father expired of a myocardial infarction at 70, and his mother died of complications of a dental procedure.
Well, his physical examination reports show blood pressure 157/86. Heart rate and irregular respiratory rate 12 to 20 breaths per minute. Reflexes are symmetric. Plantar responses were flexor, bilaterally. His cardiovascular regular rate and rhythm without murmur. HEENT shows abrasion over the right forehead. Extremity, distal right leg edema and erythema just above the ankle. Well, I have reviewed his previous HCT scan, which reveals a left parietal epidural hematoma. Right lower extremity revealed a fracture of the right lateral malleolus for which he was casted. I am ordering a repeat HCT scan to see if there is any change in the epidural hematoma. Upon seeing the reports, I shall suggest further treatments.
That is the end of Part A.